So I'd just like to go ahead and, welcome you to this. I guess it's our final installment of the spring 2021 IEI webinar series, which is sad, but we're finishing with a bang. We're really excited about this presentation today, that's for sure. So if this is your first time joining us, though, welcome. Thank you for hopping on to this webinar with us today. We have, of course, a wonderful talk on deck. Many of you know that here at the Institute for Economic Inquiry, we aim to generate robust discussions out on Creighton's campus about markets and how economic freedom affects human flourishing. We have programmings like these reading groups and research programs for undergraduates that are looking to stand out and do some research of consequence, partnered up with our excellent faculty and scholars at IEI. So, but before I introduce our speaker, I'd like to advertise a few programs we have coming up. So we have a summer colloquium. So it'll be a weekend colloquium on the works of F.A. Hayek, namely Individualism and Economic Order, and Volume 2 of Law, Legislation, and Liberty. I'm pretty pumped about it. So you feel free to if you're not leaving for the summer, or if you are leaving for the summer, apply, and we will provide lodging and your travel expenses. You'll get meals and an honorarium for participating in that discussion. Of course, you get the 2 books as well. Dr. Doug Rasmussen, our senior affiliated scholar, will be leading the discussions. And we will have that registration up on the website, www.creighton.edu/IEI, so you can apply there. Also, the deadline to apply for the fall 2021 Gail Werner Robertson Research Fellows Program is coming up quickly. If you have any questions about that, please feel free to message me or head on over to the website as well. So for today's talk, though, please leave yourself muted throughout the presentation, but be sure to unmute yourself and come live during the Q&A session to ask questions and further the discussion. This topic today is pretty debated, or highly debated, and so I'm sure it'll spur a lot of questions, so feel free to jump in. Also, feel free to utilize the chat throughout the presentation to jot comments and questions as well. So I'm excited to introduce our fantastic speaker today. Dr. Angela Dills is a professor of economics and the Gimelstob Landry Distinguished Professor of Regional Economic Development at Western Carolina University in North Carolina. She's previously held faculty positions at Clemson University, Mercer University, Wellesley College, and Providence College as well. Her research centers on policy questions, on education and health, including a variety of publications about school choice, which is the main focus of today's talk. Dr. Dills is an award-winning researcher with publications everywhere in the Southern Economic Journal, Economic Inquiry, Journal of Economic Behavior and Organization, the Economics of Education Review. Her research on school choice and how it relates to mental health has recently garnered a lot of media attention and is fueling fire to some policy discussions. So I'm excited to know a little bit more about this research and these discussions that are going on. So without further ado, I'll pass the screen to Dr. Angela Dills. Thank you so much for joining us today.
Thank you, Kevin, and thank all of you for joining me. Thank you to the IEI for inviting me. And you probably don't want to see Zoom. You probably want to see my slides. 1 second. Awesome. So as Kevin mentioned, I'm going to talk a little bit about some work today on school choice and mental health. It's joint work with Corey DeAngelis, who recently took a new position as Director of Research for the American Federation of Children, but he has held or currently holds affiliations with the Reason Foundation, the Cato Institute, and he's the Executive Director for Education Freedom Institute, on whose board I serve. And he's also mostly to thank for a lot of the media attention we get. So if you're at all interested in school choice, he's the guy to follow on Twitter and elsewhere, but he will keep you highly up to date. We were having a chat maybe a couple of years ago now about, after a recent tragedy in a public school, a young person there was another school shooting, children had died, and we were kind of talking about it in the context of school choice and otherwise, and kind of had this sort of anecdotal feel that a lot of these school shootings, if not all of them, had happened at public schools, and sort of got to wondering sort of what the role of mental health was in in these school shootings, and what the role of schools in general were with respect to mental health and other sort of very non-academic outcomes for young people. And as much of my research happens, we had this really rich conversation, and out of that grew a decision to do some research together. So there we are, deciding to try to think about what's the role that school choice might play in mental health. So I'm going to give you a little bit of background on both of those things before we get too far into the actual piece itself. So first, just to give you a sense, if you're not tracking, one of the really interesting features about what's going on with young people today is that lots of behaviors of young people are improving. So young people are having less sex and there's fewer teenage pregnancies, there's less drinking among young people, there's fewer drugs among young people. So there's all these sort of reductions in risky behavior among young people that we don't quite have explanations for. But one of the things that's not improving for young people is that if we look at deaths by suicide among teenagers, among 15 to 19-year-olds, after a long period of decline in the 1980s and 1990s, the recent history is much more concerning, where we see this large increase in deaths by suicide among young people. Deaths by suicide are highly correlated with mental health disorders. So most people, maybe as many as 90% of those who die by suicide, suffer from a mental disorder. Adverse childhood experiences, so ACE is kind of the term that people use these days. Adverse child experiences can include things like abuse or parental mistreatment, bullying in schools. These kinds of adverse events are a risk factor for both mental health disorders and suicide death. And honestly, as my 10-year-old will tell you, children spend a lot of time at school. So in fact, children spend a large fraction of their waking hours at school, and their interactions with their peers and their teachers are likely to affect their mental health. We see this in some of the existing literature. There's a couple papers out there. Let me see if I can move this. It's kind of in my way. We see this in a couple of papers out there. This Hansen and Lang paper I particularly like. What they look at is what happens with suicide rates during the course of the school year. And one of the things they observe is that children are much less likely to die by suicide during the summer than they are outside of other months, in a way that's not that differs from adult seasonal patterns in suicide rates. And they attribute this to school increasing stress and decreasing mental health. There's other research like this paper by the Plemons paper conducted by medical researchers that finds similar kind of correlations, that when school's in session, children's mental health seems to be poorer. And to the extent that stress at school stems from things like bullying and other abusive peer interactions, or teacher interactions at school, those kinds of behaviors are less common in private schools than they are in public schools. So we observe in a variety of studies that there's lower rates of bullying, lower rates of fighting at private schools than there are in traditional public schools. So what might school choice have to do with that? So before I get to that point, let me describe how we're going to define school choice. So typically I'm very big umbrella in my definition of school choice. For the purposes of this evening, we're going to define school choice in a somewhat more limited way. But you don't know, for most of the 20th century, in the US, where a child attends school is determined by where the child lives. So when a family chooses a house or an apartment, when you're choosing a domicile, part of what you're choosing in most places is where you're going to send your child to school. So it's a bundle that you purchase. So we bought a house in this neighborhood. our children would attend that elementary school and this middle school. And it's very clear if you're shopping for houses, it's one of the things your realtor or Zillow.com or anything like that would tell you. And wherever you go, families have choices among school districts when they choose where to live. So you can choose sort of where to live and thus which public school you attend, or you can choose to spend more money and send your child to private school. Starting in the early 1990s, lots of states adopted charter schools. And charter schools, which is one of the kinds of school choice I'm going to consider today, charter schools are publicly funded, but privately run schools. So in many cases, they're run by charter management organizations or educational management organizations, but they're privately run, publicly funded schools. And in many cases, these are going to provide additional options with no out-of-pocket expenses for nearby families. So they're public in that if your child is admitted, you may send them with no out-of-pocket costs. A more limited number of states have adopted voucher programs. Typically, the way a voucher program works is that a family would receive the state fraction of school spending, which is usually something a little less than half of what a traditional public school would spend on a student. Many vouchers give families that state half of the school spending for families to spend on educational expenses. For many families, this means using the voucher to send their child to private school, where the voucher can offset a lot of the out-of-pocket costs of attending a private school. And private schools are generally an option as well. One of the things that vouchers do is make private schools more affordable, particularly for a wider range of families with a wider range of socioeconomic backgrounds. It also, by subsidizing private schools, provides more opportunities for private schools to open and serve students. If you're curious, those of you in Nebraska, Nebraska has none of this. I mean, Nebraska has private schools. That's certainly the case, but Nebraska does not have charter schools. Nebraska does not have any kind of voucher program. So Nebraska does have a really interesting open enrollment policy, which isn't that common across states, where families could send their child to any public school, whether they're zoned to it or not. So that's a little bit different. We're not going to treat that as school choice. But Nebraska is a little bit of an outlier in kind of how they don't have to the degree that they have very little school choice in that way. Right. So let me give you a sense of what these programs look like nationally. I'm just going to keep moving my pictures of you guys. These are data from the National Center for Education Statistics to give you a sense of enrollment in charter schools. So the magnitude here is about 3% of this is not percents, this is in millions, about 3 million children are enrolled in charter schools in the 2017 school year. If you look at voucher programs, that one's a little bit harder to estimate. The big thing I want you to note in this graph is that, I mean, certainly one thing to note is that voucher programs are increasing and enrollment in voucher programs is increasing, but the levels are really low. So there are a number of voucher programs across states, but in many cases, they're capped in how many people can participate. And they tend to affect many orders of magnitude fewer students than the charter schools do. And if you want to see private school enrollment, that's what this one is. It's pretty flat over this period in general. This will give you a sense. Private school enrollment's about 6 million children. That tends to be roughly 9-ish% of the school age population that's enrolled in private school. And a huge chunk of that are Catholic school students. So it's typically in recent past, it's typically been about half. That's gone down in more recent years. Other religious schools make up another big chunk. So the vast majority of people who attend private school in the US are attending a religious school whose tuition is not, I think depending on sort of your background, you might think private school, and some of you may think like fancy college prep school, it's going to cost tens of thousands of dollars a year. And those exist and they're very expensive, but that's not the typical private school experience for most people who attend private school in the US. It's a much more affordable experience where private schools on average are spending slightly less than the US average public school spends. Okay, so those are the kinds of choice we're going to think about. And so let's get to the question. So we're going to think about sort of, does school choice affect children's mental health, or does it affect mental health in general? We're going to look both at adolescents and at adults. And let's start with thinking about what are the mechanisms by which that might happen. Okay, and I'm going to consider a few. So the first is that schools of choice, charter schools, private schools, might be better schools. And in fact, almost all of the research that considers the equality of schools of choice shows that these schools are at least as good, if not better, than nearby traditional public schools. And better schools do lots of things. Better schools improve academic outcomes, or they're at least as good as test scores, at least as good of educational attainment, likelihood of going to college, things like that. But better schools also improve non-academic outcomes. So we have good evidence that private schools do, that better schools do things like reduce teen pregnancy, reduce criminal interaction with the justice system, and things like that. And it may be the case that in particular, private schools, and as you could see before, particularly religious private schools, may focus on activities that support children's mental health more explicitly than the typical public school does. What about all the other students? So when you have more school choice, it's the case that some children will leave traditional public schools and attend those schools of choice. They might take a voucher to attend a private school, or attend a newly opened charter school. But that also means that other students are staying in the traditional public schools. And one of the questions that frequently comes up with school choice is sort of what happens to all the children, or to the quality of the traditional public schools. And most of the research shows that in the presence of increased school choice, traditional public schools perform at least as well, maybe better. It's a little bit mixed on whether it's zero or positive when they're confronted with more school choice. And the basic idea is this. So when the traditional school's funding is based on how many children enroll in their school. So when there's more competition, when families are attracted to attending other schools, to a new charter school, or to private schools that are now suddenly more affordable, that increased competition provides some incentives for the traditional public schools to make their school more attractive to families, improving their academic and non-academic outcomes. One of the things that happened, we very recently, where I live, there was a new charter school opened after North Carolina had lifted their charter school cap. And it was very explicit what had happened in terms of the school principal talking to the local paper about all of the benefits of attending the traditional public school. We can see it happening in our everyday lives, but we see it happening in the data as well. Right. So children can move to better schools, to schools of choice. The competition improves the system as a whole. Even if the schools of choice are not better in an unequivocal way, one of the things that having more choices does is it allows families to sort into schools that best fit the needs of their child, whether that's schools with a different kind of curriculum or schools with a different kind of culture. All of those things can be really important to families when thinking about the right school for their child. And having a school that fits the needs of your family and fits the needs of your child allows your children to flourish and your family to be more successful. That fit can happen at the traditional public school as it changes in response to competition, but that fit can also happen with the new schools entering with additional school choice. And maybe particularly importantly for the question that we're addressing today is that school choice acts as an escape valve. So large fractions of children experience or participate in bullying at school. So roughly 35% in one survey were either experiencing bullying or participating in bullying. And about 15% of school children are involved in cyberbullying. So bullying and those kinds of Really negative peer interactions are quite common in school. And one of the things that school choice can do is to provide an affordable option for families and to allow them to escape a school who's either not willing to or unable to adequately address a bullying situation. So we can think of a variety of mechanisms. If you have others in mind, I'd love to hear them as well in the Q&A, but certainly there's lots of sort of theoretical reasons and reasons based on the existing research that we might think that school choice affects mental health. Right. And there's a little bit of research that looks at it as well. So including some of my own. So we know that school choice affects other kinds of behavioral outcomes. We're going to end up looking at suicide. So I don't know if I want to call that a behavioral outcome, but we know school choice reduces disciplinary incidents and crime rates. And there's a couple papers who look at how private schools and public schools compare and find that their students have at least the same or less attempted suicide in private schools than in public schools. One of the big issues here in trying to answer this question is we might think that private schools are able to screen out children with poor mental health. One of the things that the paper by Mojan and Tekken do is to use propensity score matching to try to address this selection concern. And for what they find is that Catholic school attendance has no effect, or maybe it reduces attempted suicide. Right. So there's some existing literature that supports the possibility of a link between school choice and mental health, but we want to still explicitly answer the question. So we're going to ask really two questions that kind of get at the same relationship. So the first is, how do vouchers and charter school laws affect state level adolescent deaths by suicide? And the second is, do students who attended private school experience better mental health outcomes? I'm going to go in order. So first, so more explicitly, how do vouchers and charter school laws affect state level adolescent deaths by suicide? So that when we go back to my graph, remember our graph, we're trying to think about what's going on. How much can school choice explain some of these trends in adolescent suicide? And what we're thinking about is an outcome here, which is deaths by suicide for young people, for 15 to 19-year-olds. Suicide rates for children younger than that are actually really quite low, thankfully. So these are state level deaths due to self-inflicted harm. These come from the CDC, from the Center of Disease Control's National Center for Health Statistics. And it's a pretty standard difference in differences, or more correctly, a two-way fixed effects model to estimate this, which I'm going to tell you what it is, because I know I have lots of undergraduates, right? So I'm going to give you a quick little metrics lesson too. It'll be awesome. All right, I'm going to think about 3 school choice laws. Does the state have a voucher program? Does the state have a voucher program that's only for students on an individualized educational plan, which are special education students? And does the state have a charter law? So again, Nebraska here has none of these. So in the data, Nebraska is in my never column of states that never adopt each of these laws. Okay. And then I have a set of states, I'll show you in a minute, who have adopted these laws. And the first thing I want to point out here is, if we look at which states are adopting the school choice laws, not a terribly clear pattern. Like suicides are lower in states that adopt voucher laws, but they're lower in states for IEP voucher laws, or suicides are lower in states that never adopt IEP voucher laws, and suicides are lower in states that never adopt charter laws. So the first thing I want to note is there's maybe some differences across states and who's in the levels of suicides for who's adopting these laws. And then sort of looking at those last 2 columns on the right, is that's in the states that do adopt these laws, what happens to their suicides before and after. And primarily what I would like you to notice is that suicides are increasing. So, and in part, this is the secular trend. This is what's going on in the US, is these laws are being passed in the 1990s and the noughts, and since then in the teens as well. And so at a period of time where suicides in general are increasing. So what we need to untangle is how much of that is the secular increase, the national increase in suicides that's occurring among young people, and how much of that is due to the change in the legislation in these states. There's the trend I was just talking to you about. Okay. All right, so Kevin, you'll appreciate this is actually my husband's graph, but I use it all the time. So my husband's also an economist. He lets me steal his slides sometimes. So here's a little quickie graph about what difference in differences is. So let's think about, in our case, I've redrawn the graph to reflect what's going on in our data. So that blue line are going to be the never adopting states. So we can think about what's happening to suicides during this period of time in the states that don't adopt school choice laws. Well, it's going up. And then the red line is going to be the adopting states, the states that you do adopt these school choice laws. Their suicide rates are also going up. We saw that in the table that I just put up. But what we're going to see when I show you the results, or when I tell you the results, is they're not going up as much. Okay. And so when we do difference in differences, effectively what we're doing is we're controlling for state level differences in the average outcome. So it may be, I didn't look, actually, I meant to. I don't know what suicides look like in Nebraska and other places. Some states have higher suicide rates than others do. And part of what we're able, all the time, and part of what the two-way fixed effects does is control for those those differences that happen all the time. And then the other set of fixed effects, which is over time, is going to allow us to control for trends that are common to all states. And what we're trying to untangle is how much of this change over time is due to the change in legislation, the change in school choice, and how much is due to sort of other things that are affecting adolescents across the country. Ceteris paribus, holding everything else. Hopefully you've all have heard that at some point in time in your life, right? Maybe you have a professor who even uses the Latin correctly and says like ceteris paribus or something, but I can't bring myself to say it. I don't know. Kevin will have to tell us in the Q&A how he says it. What are we going to hold constant? We're going to hold constant a bunch of stuff that other research tells us affects adolescent suicides. So we're going to control for economic conditions. We're going to control for demographics. We're going to control for laws that affect access to drugs and alcohol. And because we know that these things, we know from other research, that these things affect suicides. If you want to see the timing change, so I've shown you lots of what my outcome variable looks like. Here's what the, get a little extra preview there. Here's what the laws look like. You can see the charters started and they just took off really quickly, although some states are still slowly adopting them. Vouchers were a little slower to start. This is the number of states with the program. Vouchers were a little slower to start and have been slower to expand, but continue to expand. All right, and what do we find? I'm not going to show you any fancy tables, but they exist if you're interested. So, effectively, what we find is this. So states that adopt charter schools see about 4 fewer deaths by suicide on average. So that's about a 10% decrease in 10% at the mean decrease in suicides. The charter school result is really robust. It's robust to doing it, estimating it with a negative binomial, which accounts for the fact that it's a count variable. They're robust to doing like an event study specification. So if you're way up on the two-way fixed effects literature, which I'm trying desperately to be, that I think helps be convincing that the two-way fixed effect is picking up actually a causal effect of charter schools on suicides. The effects for the voucher laws it's pretty mushy, honestly, is my technical term for it. So in some specifications, we find some declines, but it's not particularly robust. And I'm not going to hang my hat on any effect of vouchers here. I will say I don't find it terribly surprising. Part of the reason I showed you the enrollment data at the beginning is that there's so many more children who are enrolled in charter schools than who have access to a voucher program. So it doesn't surprise me that we can find in the data effects of charter schools on adolescent outcomes, but not for vouchers in the sense that it's just not that many children who are able to take advantage of them. Right, so pretty convincing evidence, I think, that having a charter school leads to improved mental health for adolescents, particularly when we're measuring mental health with this pretty severe outcome of deaths by suicide. Right. And then our second approach to asking this question about how school choice affects mental health is we're going to ask specifically about private schools. Do students who attended private school experience better mental health outcomes? This is a little bit of a challenging question to answer because, as you might imagine, there's a lot of selection into private school or not. So we're going to do our best to address it, and I'll talk to you a little bit how we're going to do that. But we're going to answer this question using some survey data that's able to track, that's going to ask people both about their schooling experiences and about sort of their mental health at a variety of points in time in their life. The data we're going to have is we're using, I always get the name wrong. So we're using data from the 1997 National Longitudinal Survey of Youth, the NLSY. It's provided through the Bureau of Labor Statistics. And we're going to use 4 different years of the survey. So the initial year of the survey is 1997. And so the entering cohort, the cohort that they're following in 1997 are adolescents. So they're in school and they're asked in 1997 whether they attend public school or private school. So this is the first piece that we need. We need to observe where someone went to, what kind of school someone went to. The outcomes we're going to look at are 2 outcomes when they're adults. So we're going to observe them in 2011 and 2013, and they're going to be sort of in their late 20s, early to mid 30s at this point in time in the sample. So yeah, late 20s, early 30s. So they're out of school, working generally, so more established adults at this point in time. And we have 2 measures of adult mental health. What they're asked in the 2011 survey is how many times in the past 12 months have you been treated for a mental health issue? As you can see, those rates are relatively low. So on average, they were treated 0.15 times. So some people are treated 1 time in the past 12 months or 2 or 3 times, but there's lots of zeros here. So lots of people don't have any treatment for mental health. And then to point out here as well that for people who attended private school in 1997, they have lower number of times treated for a mental health disorder when they're in their late 20s. Okay. And then the second outcome that we have is they're asked in the 2013 survey, do they have a mental health disorder is literally what they've been asked. So again, they're relatively older. The rates of these are self-reported. So these are surveys where people are individually filling them out. These prevalence rates, so this is 3% of people who attended public school as an adolescent say they had a disorder in 2013, and 0.8% of people who attended private school say they had a disorder in 2013. These are significantly lower prevalence rates than we see in the overall population. So just to give you some caveats here. Okay. Effectively, what we're going to do is we're going to think about estimating the effect of attending private school as a young person, a bunch of controls for your family background. And the other thing we have is in 2000, so they tell us in 1997 what kind of school they went to. And in the 2000, the survey asks a series of questions that basically serves as like a mental health panel. What it reminds me of is what the questions your OBGYN gives you right after you have a baby is like a screening for postpartum depression. It's kind of those sets of questions of how you're feeling. Fairly standard sort of set of questions that one would be asked to screen, to sort of do a rough screen for a mental health disorder. So that's observed a couple years after the private school. So we're going to control for that as well, and then allow to see how the effects are on their adult mental health. And we control for a bunch of stuff. So we're going to control for the parental education, how old they are, how big their household size is as an adult, their demographics, whether they live in a metropolitan area and the region they live in as well. Oh, you could actually look, fancy tables with stars, my favorite part. Okay, so basically what we find is this. So what we find are that people who attended private schools, adolescents, are less likely to report having a mental health disorder as an adult. They're less likely to, they report lower numbers of times treated for mental health disorders as an adult. So we have a couple different measures of adult mental health. Both of those are lower for the people who attended private school, even controlling for their adolescent mental health score in 2000. So again, suggestive, supportive evidence that having access to schools of choice, being able to attend a private school might improve mental health, not just in the short run for while you're currently in school, but adult mental health as well. So like all research, neither study is perfect. We may have lingering concerns about omitted variables bias or selection or other threats to causality. But what I like about how we kind of put this paper together is that each piece of the study measures mental health differently, and it implements a different empirical strategy. So what we're relying on to identify our causal effect of school choice and mental health is different. And that consistent pattern of results across samples, across time, across measurement, across empirical methods, all supports this conclusion that school choice improves mental health. Let me talk a little bit, I think I have a couple minutes, so let me talk just a little bit about maybe how relevant, even particularly relevant it might be today. So as Kevin mentioned, this paper drew a significant amount of attention when we first released it. But when the schools closed for in-person learning, that's also renewed attention for these results more recently. I think because many people are concerned that virtual learning may harm children's mental health. And in fact, it's true. Isolation can be really bad for many people's mental health. And virtual learning does two things. It removes many children from the support of their teachers and their peers. In some cases, though, it also removes many children from the harmful interactions and bullying that they're experiencing from their peers. It's not totally, like, not all children necessarily are so sad that they're engaged in virtual learning, but many are. Okay. And as public schools have dragged their feet towards reopening for in-person learning, which Corey has another recent paper, he shows that that choice of not opening seems to be driven by union power, not by COVID prevalence. But as these public schools have really hesitated to open again for in-person learning, we might want to think about how important, how much more important school choice might be for many families. Some families, many families, in fact, if you look at the survey evidence, aren't ready to send their kids to in-person learning, and that's fine. The great thing about school choice is it allows families to find schools that best fit their needs and preferences. It's schools that fit their risk tolerances. School choice programs allow families the option to sort into the schools whose delivery method, including as well as their curriculum and their school culture and other things that we are typically concerned about with school choice, but also their delivery method might make a big difference for some families who are struggling to balance the health of their children, the mental health of their children, and their own scheduling needs. So I'm very encouraged. I think we're going to learn a lot about school choice and other sorts of aspects, as we've seen parents make many different choices during the pandemic. But in the meantime, I'm going to look forward to all of your questions. So I hope you'll ask them now, but if you don't get a chance or just want to extend the conversation, please feel free to email me. My email is there. So, thank you. I'm going to stop sharing, maybe. There we go.
Awesome. that was great. Thank you so much. Yeah, so if any of you have any questions that you'd like to ask Dr. Dills, feel free to raise your
Um,
hand, unmute yourself. Go for it, Taylor. Yeah.
have you looked at this on like a regional basis, like the West Coast versus like the East Coast versus like the Midwest? Like the availability of school choice, and then like already in conjunction with like the coasts are much more densely populated. Um, so it would be natural that there would be more school choice. But do you see even like from like a like political perspective, like does that affect the policies that are in place in the states regarding school choice?
I slipped right over it, but if Kevin doesn't mind, I'm going to show you my map. That might help, Taylor. Hold on just a second. Let me share my screen again, and you can see the well, maybe you can see the school choice map. So here will give you a sense. You can the grayed out states like lonely little Nebraska there that has no school choice, right? So, but then you can sort of see like what other states look like. So sort of West Coast, they have charter schools, but not a lot of voucher programs. The Northeast, or if I'm thinking kind of where the blue states are, like in a political map, I think that's to sort of get to your question. They are more likely to have charter school programs than they are to have private school choice programs like a voucher program. The South tends to have both. So I don't know if that's consistent or not consistent with the story you have. Maybe you could tell me a little bit more and we could work it out. But like there are lots of I mean, the charters are kind of all across the country, but maybe a little less common in the middle.
Yeah.
Yeah.
And that I would thank you for showing the map again. Seeing the visual just helps a lot. So that's really interesting, and it'll be interesting to kind of see how that sort of evolves into the future.
Yeah, and there are a lot of states making moves towards more school choice. I think a lot of families, the families who really want their children back in in-person learning have done a lot to kind of pressure some state legislatures to give them the money to allow them to do that. So there's a lot of states who are considering school choice that maybe weren't before. So it's a really interesting time to be in that context. So thank you.
Thank you.
Do you want me to answer Morgan's question, Kevin?
Yeah, so yeah, go
Okay.
for it. You see the chat too, so cool.
All right. So Morgan asks, what is your view on limiting policies such as charter school caps? So I'm not. So right. So North Carolina is probably a good example of that. So there are 100 counties in North Carolina. And when North Carolina initially adopted their charter school law, the cap was that there could be 100 charter schools. I think with the idea that every county would get one, but I live up in the mountains. I live in a very rural part of North Carolina. The joke around here is we live closer to like 5 state capitals than we do to our own, but just because we're kind of North Carolina is a weirdly shaped state. And so when the charter school cap was lifted, it meant a couple things for the state. It meant that Charlotte and Raleigh, sort of our big metropolitan areas, were areas who had a lot of demand for more charter schools, were able to actually open enough to meet the demand. And it meant that even rural places like us could get one. So they're still far away, and it's not a great option for a lot of families because it's rural and it's hard. But I think we don't really need charter school caps in the sense that the charter school is not going to be successful if families don't enroll. They need families to enroll to get funding and to pay their bills and to hire their teachers. So the market, sort of families themselves, sort of naturally provide a cap. We don't without the government needing to do so, because how do you open a school if nobody's going to come and get you funding, right? So I think removing the charter school caps has been good for a lot of people. and that families do a pretty good job of regulating whether those charter schools are successful or needed. So Adam Swisher asks, is there an optimal amount of school choice to gain the benefits? How would in smaller communities, how would school choice operate? Great. Is there an optimal amount of school choice? Probably there's an optimal amount, but I bet it's different everywhere. So I think the challenging thing here is that, let's say you live in a place that has excellent public schools. I went to public school my whole life. And I went to some of the best, I went to the best public high school in the country. There you are. It was great. I had a wonderful experience and I was well prepared for college. It was great. And it was zero out-of-pocket costs for my family, right? Probably people who live in places like that don't need a lot of school choice. They live in a place that has lots of options. And in fact, in general, families that have money have school choice. If they can afford to live in a high quality school district because they can afford to buy a house there. They can afford to send their kids to private school because they have disposable income to do so. The people who need the school choice are the people who don't have the financial resources to do that, who find themselves in a public school that's not serving their children's needs and would like to have another option. So I think the optimal amount of school choice is whatever the families need and want. If they don't need it or want it, they won't go to those schools or use those programs. They'll stay in their traditional public schools. Why wouldn't they? But if they do need and want it, then having those options available to them can be really enriching for their children. Do you say Jetta? Do you know Jetta, Kevin? Am I saying it wrong?
Utah.
Juta, thank you. Juta asks, do I include options for homeschooling laws in your definition of school choice? Okay, so generally speaking, when I give like general talks about educational choice, about school choice, I'm really big umbrella. I include everything. I include TVU choice, like choosing among school districts. I include homeschooling, charter schools, whatever. Like all of those are choices that families have options to them. I am not in this, we do not in this paper look at homeschooling laws. I am for a totally different project in the middle of trying to code homeschooling legislation. And it's an enormous mess. So I'm working on it. There's some regulatory kind of sort of loosely collated regulatory databases on homeschooling that I'm kind of working to kind of put in an empirical format. So we don't. You may be interested, and maybe if you send me an email, I'll send you a draft. One of the things I'm working on right now is a paper on homeschooling and child abuse, which is kind of related to this. It's not exactly related to this, but sort of thinking about what homeschooling does. So I think homeschooling is school choice. I think some states make it very easy to homeschool and some states make it very challenging to homeschool. And that probably makes a difference in how many people homeschool. Generally speaking, the literature on homeschooling is a little bit limited because there's huge problems. The empirical research, at least, there's lots of really interesting qualitative research, but the empirical research is a challenge because there's so much selection into homeschooling. Those are very different families who choose to spend that amount of time and resources educating their children. If nothing else, we know they're heavily invested in their children's education. And so to untangle that parental investment from whatever schooling, I'll put it in quotes, whatever educational sort of inputs they're receiving at home versus what they would have received in a traditional school is really hard empirically. So it would be good to do that. I'm not sure that it's been done yet. So working on some of it.
So I have a question about mental health. So I've been reading Haidt's Coddling of the American Mind, and I guess a few in this meeting have as well. And you know, looking at safe spaces and looking at kind of the degradation of what we mean by mental health. So you're looking at mental health by just suicide rates, or or are you looking at it by, are you adding any other components, right? And with COVID-19, so COVID-19 could be like really cool for school choice, if at least cool in the sense that it expands school choice a bit more. Um, but what will that do to your research on mental health? Because COVID is all over the place. It seems like it would be a really cool natural experiment, but also like it could, how is your study going to kind of last and like inform us post COVID?
Yeah, so on the first question, so in the first sort of half of the paper where we're looking at deaths by suicide, we're just looking at suicide. So there's some advantages to that. So I also do a lot of work on crime, and one of the reasons economists or empirical researchers like deaths is because they're well measured, right? Like I mean, we observe that they're just well, yeah, right. There's a death
Someone
certificate,
dies,
right? Like we
they're
know
dead.
who died and who didn't die.
Right.
There's a lot of other sort of levels that are much harder, right? Like we know you know, in the research in ADHD, and even that's probably the one I'm most familiar with. We know there's a lot of varying diagnosis and sort of that's not consistent with it all being an easily measured, clear bar to hit, right? And so the nice thing about looking at deaths in empirical research is it's well measured. The less nice thing is we're missing a lot, right? I mean, plenty of people have poor mental health and it doesn't rise to the level of a death by suicide. And it would be great to sort of capture a richer experience of that. So partly we're trying to get at that in the second piece of the study because we have the survey evidence on self-reported mental health outcomes. But again, my guess from comparing the survey data to some national prevalences, there's a lot of underreporting, like many things that people prefer not to say on a survey. So that was the first part, right? So then the second part was like, how are we going to possibly untangle all the effects of COVID, I think is sort of the question. Yeah. I think it's a challenge. I suspect so my general theory is research for the next like 5 years is going to take, empirical research is going to take one of two forms. Either we're looking at something specifically to do with COVID. So we're really focused on good data in 2020, 2021, or we're just going to put in a dummy for 2020 and like ignore it. Try to dummy it out of the data, because what are we going to do, right? And I suspect a lot of it's going to look like one or the other until we get enough years past where like one of the benefits or one of the limitations when you do empirical research is you need a lot of variation. So to the extent that more students have access to school choice programs, or maybe they only end up having access for a few years and then, you know, people pull back on that because they were passed during the pandemic times. I don't know, right? But I do think sort of empirically, one of the things that it's likely to give us is a lot more variation in the schooling options that children have during the course of their K-12 career. So in an ideal world, we'd be able to track that. How we deal with like, you know, I think there's going to be a lot of differences. So I'll give you a little anecdote. My kids are in 1st, 5th, and 8th grade. I got to think about it. And that's all very different. It's very different to be finishing kindergarten, not really able to read and trying to do online learning than it is to be like on your phone with your friends all day long in middle school doing online learning because you can very capably, and then everything in between, right? So I think even for different age children, there might be very different sources of variation that we can use in terms of how that affected their intensity of schooling, how that affected their family life. There's just so many moving pieces that it'll make for some interesting times.
Yeah.
So
That's good. So if there's any other questions, feel free to jump in to ask. Um, so one of the things that I'm thinking about too is like, so why is it that since the 60s there's been such a pushback against school choice? And is this and is it just because we're calling it school choice? A lot of it is that there's a big separation inequality, that there are concerns there that people can do whatever they want, but they still can do whatever they want. You know, if you have money, you can go wherever. So how does your research help kind of inform that? And like, what's the debate? What's the critique on your research, if any, if there has been any critique on your research, at least from the policy side?
Yeah, so I think a lot of the arguments I hear against school choice are a concern that it might lead to the end of the traditional public school system, a concern that it might leave behind families that aren't paying enough attention to make a choice for their child. And I think a lot of the tenor of it, not all of it, but a lot of the tenor of it sounds like we don't trust particularly low socioeconomic status families to make good schooling choices for their children. Which I think does a disservice to a lot of families. I think that families, and maybe in fact, this is a really useful piece of this research, is families care about all kinds of things. Like families don't really care about test scores other than the fact that they are good markers for sort of future success. Like if you're testing well, you'll probably do okay on your SAT and get into a good college. And if that's something, that's the path your families care about safety. One of the number one reason that families in some of the initial school choice literature, the number one reason families took up a school choice program is because they wanted their kid to be safe. Yeah, I mean, don't we all, right? Like, but that's not going to show up in all the academic literature, like all the academic outcomes. That's not going to show up in like, did you get better test scores or did you stay longer in school? Other than the fact that like the child is probably more content and happier. And I think that it's really useful to kind of see things like this, like it's affecting children's mental health to be in a school that's unsafe, to be in a school where they're negatively interacting with their peers, and for their families not to feel like they have another option. They don't have the money to send them to private school. They can't take time away from their jobs to homeschool their child or find an arrangement to do that. And I think all of those observing this relationship highlights a lot of those concerns that families have, particularly some lower income families that are in public schools that frankly are serving them very poorly. Maybe to tie that a little bit back to your earlier question, Kevin, one of the things that's happening kind of concurrently with a lot of this pandemic, it started before the pandemic, but has really accelerated, is people are really innovative in how they homeschool their families now. Like how they homeschool their children now. Like there's co-ops, there's hybrid programs, there's virtual programs, like in ways that make it so that you could have a single parent homeschooling or two working parents homeschooling instead of, what felt like to a lot of families for a long time, having one parent have to stay home with the children to educate them at home. And I think that seeing that variety of options has also been helpful for families who need another choice, who need another option for their children, who's frankly suffering in the school that they were assigned to. So
yeah, it seems like agency really makes a difference when you're able to choose, select a school, and you have the option to select a school. You tend to care a little bit more, right? If you're not given an option, then you kind of check out. I would imagine.
We see that even with families who are very consciously thinking about the school district they're choosing when they buy a house. Even those parents who say that are more invested in thinking about in their schools, and they felt like they chose their child's school by making that choice, and it's important. Yeah.
Awesome.
Great.
Well, cool. So we're at 5. We're a little over 5. Thank you so much, everyone, for joining us today. Thank you, Dr. Dills, for for coming in. This is a fantastic research. And I think really innovative, and you know, I'm really excited to see what comes out of that, out of this paper. It seems like it's causing a lot of derivative action. So
It's wonderful. Thank you for having me, Kevin, and thank you for all of your questions. I appreciate it.
all right, y'all. Well, have a fantastic rest of your day. We'll see you next time. Thanks so much.
Thank you.